Hello, welcome. We're glad to have you register for the NOVO Health Conference. And as part of our giveaway this year, we are giving away some low-tech but high-tech solutions for note-taking. I've got with me Angela Russ to explain exactly what we've got and how it's going to work. Angela?
Yeah, we're excited to share with you our Rocket Books. These are really fantastic tools. You can write in them like a regular old notebook. And then you can take a picture with your smartphone and send it to any number of different locations like an email or a cloud-based folder. Really easy to help you stay organized. We're going to be sharing some instructions with you about how you can communicate with us live during the event using your Rocket Book. I am not a tech person, but I find these really easy to use, and we're excited to have this way to communicate with you and let you share your ideas and questions throughout the event.
Congratulations! Your health benefits include a NOVO Health Bundled Payment Program. This special benefit is brought to you by high-quality healthcare workers in your community who want to see you today, resolve your issue, and save you and your employer money. It's a healthcare option added to your existing healthcare insurance and there to take advantage of whenever you need it. And let's say that's today. Here's how it works. Call Care Navigation or tap it directly from the NOVO Health app. Select a healthcare provider qualified to best meet your needs. Connect with a scheduler to set your appointment. Receive care in a NOVO Health Center of Excellence from specialized providers in an outpatient setting that is easier to use and less costly than a hospital stay. Care Navigation connects you to our ever-growing panel of independent specialists for orthopedics, spine, pain management, foot and ankle, women's care, plastic surgery, and heart and vascular care. These physicians are 100% board certified and offer you priority access appointments within 48 hours if medically appropriate. We've packaged many common procedures into easy-to-understand bundles, so there's one price known in advance and one bill. This eliminates that parade of separate bills you may have experienced in the past. Bundles come with a limited warranty in case you need extra recovery services at one of our sites. If your procedure isn't yet on our bundle list, you still get a seamless experience with Care Navigation and priority access to top-level providers in your area. Connect with NOVO Health today to get started. Schedule your consultation, meet with a provider, and make a plan. You get high-quality care. Your employer keeps medical costs down. You support providers with independent businesses, keeping jobs, and better health care in your community. Download the app for future reference or call us at any time.
welcome. We're glad to have you register for the NOVO Health Conference. And as part of our giveaway this year, we are giving away some low-tech but high-tech solutions for note-taking. I've got with me Angela Russ to explain exactly what we've got and how it's going to work. Angela?
Yeah, we're excited to share with you our Rocket Books. These are really fantastic tools. You can write in them like a regular old notebook. And then you can take a picture with your smartphone and send it to any number of different locations like an email or a cloud-based folder. Really easy to help you stay organized. We're going to be sharing some instructions with you about how you can communicate with us live during the event using your Rocket Book. I am not a tech person, but I find these really easy to use, and we're excited to have this way to communicate with you and let you share your ideas and questions throughout the event.
Congratulations! Your health benefits include a NOVO Health Bundled Payment Program. This special benefit is brought to you by high-quality healthcare workers in your community who want to see you today, resolve your issue, and save you and your employer money. It's a healthcare option added to your existing healthcare insurance and there to take advantage of whenever you need it. And let's say that's today. Here's how it works. Call Care Navigation or tap it directly from the NOVO Health app. Select a healthcare provider qualified to best meet your needs. Connect with a scheduler to set your appointment. Receive care in a NOVO Health Center of Excellence from specialized providers in an outpatient setting that is easier to use and less costly than a hospital stay. Care Navigation connects you to our ever-growing panel of independent specialists for orthopedics, spine, pain management, foot and ankle, women's care, plastic surgery, and heart and vascular care. These physicians are 100% board certified and offer you priority access appointments within 48 hours if medically appropriate. We've packaged many common procedures into easy-to-understand bundles, so there's one price known in advance and one bill. This eliminates that parade of separate bills you may have experienced in the past. Bundles come with a limited warranty in case you need extra recovery services at one of our sites. If your procedure isn't yet on our bundle list, you still get a seamless experience with Care Navigation and priority access to top-level providers in your area. Connect with NOVO Health today to get started. Schedule your consultation, meet with a provider, and make a plan. You get high-quality care. Your employer keeps medical costs down. You support providers with independent businesses, keeping jobs, and better health care in your community. Download the app for future reference or call us at any time.
welcome. We're glad to have you register for the NOVO Health Conference. And as part of our giveaway this year, we are giving away some low-tech but high-tech solutions for note-taking. I've got with me Angela Russ to explain exactly what we've got and how it's going to work. Angela?
Yeah, we're excited to share with you our Rocket Books. These are really fantastic tools. You can write in them like a regular old notebook, and then you can take a picture with your smartphone and send it to any number of different locations like an email or a cloud-based folder. Really easy to help you stay organized. We're going to be sharing some instructions with you about how you can communicate with us live during the event using your Rocket Book. I am not a tech person, but I find these really easy to use, and we're excited to have this way to communicate with you and let you share your ideas and questions throughout the event.
Hello, welcome. We're glad to have you register for the NOVO Health Conference. And as part of our giveaway this year, we are giving away some low-tech but high-tech solutions for note-taking. I've got with me Angela Russ to explain exactly what we've got and how it's going to work. Angela?
Yeah, we're excited to share with you our Rocket Books. These are really fantastic tools. You can write in them like a regular old notebook, and then you can take a picture with your smartphone and send it to any number of different locations like an email or a cloud-based folder. Really easy to help you stay organized. We're going to be sharing some instructions with you about how you can communicate with us live during the event using your Rocket Book. I am not a tech person, but I find these really easy to use, and we're excited to have this way to communicate with you and let you share your ideas and questions throughout the event. NOVO Health community. I'm excited to welcome you to NOVO Health's 2021 virtual event. Today, our community of innovative companies is coming together to challenge the status quo of healthcare. Now, we know there's no shortage of products and programs and plan designs that claim they're going to fix the problem we have with healthcare robbing us of our resources. And yet, here we still are. So what's happening? Are we still picking the wrong products, the wrong plan designs? We think that there's more to it. At NOVO Health, we got trapped originally in the same type of thinking as I see in many companies. We knew we wanted to be innovators. We were trying to innovate that perfect product, that silver bullet, that program that would really make healthcare affordable and accessible. Now, we made some really great programs, if you ask me. We've gotten some great results for companies that are here with us today, and we are proud of those programs. But you know what? Healthcare isn't static, and the solutions of one company are not always the best fit for another company. And we know that the solutions of tomorrow might look different than the solutions of today. And that's when we realized NOVO Health didn't need to just build a product or a program. It's the process, stupid. NOVO Health set out at that point to build a platform and a process where we can all innovate together as a community. That was the birthplace of the NOVO Health market, where many programs and products can be offered today and to adapt to our changing conditions over time. So we're so glad you have decided to join us today. We are going to be tackling innovation in terms of innovative products, innovative solutions, but also we're going to challenge you to think differently with us of innovation as a process, as a problem-solving process and a way to drive change. Now you're going to hear from Craig Dickman of Titletown Tech, Steve Tynk from Fork Farms, and Kurt Kubiak, the CEO of NOVO Health. They'll talk with you about how you can foster innovation and how sometimes small changes can have a big impact. Next, we're going to tackle a problem that all of us face. We are asking people to change their behavior, sometimes then to change it again. How do we do that? We're going to introduce you to what we call the 5 steps to healthcare independence. People need our support if we're going to ask them to implement our programs and the solutions we've selected year over year. And the 5 steps to healthcare independence is a formula we've designed to do just that. It's based on our study of behavioral science research and real case studies of our most successful participating companies. We're excited to share it with you. Healthcare independence means stepping away from the status quo of being dictated to about where you can go and how you can spend your money. As a patient, it means I get to choose my healthcare provider and the right fit for me. As a company, it means I get to choose to support other companies and invest my dollars with those who believe what I believe. It means the opportunity not to just fund the profits of mega corporations, but to reinvest in my family, in my company, in my community. That's the reward for innovation. That's healthcare independence. Let's get started.
Good afternoon. My name is Craig Dickman, the Managing Director at Titletown Tech. I'd like to welcome all of you to the NOVO Health live event, and we're very excited that you're joining us here today from Titletown Tech, literally in the shadow of Lambeau Field. Titletown Tech is a partnership that was formed by the Green Bay Packers and Microsoft, really to help create, scale, and grow businesses within this region. We're very excited to be connected to an event like this because if you look at Titletown Tech, we really focus on 5 key areas, one of which is digital health. In fact, over the time that we've launched Titletown Tech, digital health has been really our most active of all the verticals, especially when you consider the connection that health has to so many other things. So we see not only things taking place in digital health and ways to use technology and data to transform health and healthcare, we also see where it resides at the nexus of health and sport, health and agriculture, health and water, so many things that are connected in health. And so we have a unique opportunity here to work with entrepreneurs who have ideas. And that again is so much of the process here at Titletown Tech. It's working with something we call need-based innovation. Somebody sees a problem, sees something in the marketplace that needs to be solved, and we bring together people who put their focus and their energy on coming up with solutions to address some of those challenges, and then utilize this network that we have here, not only from the Packers and Microsoft, but from other companies that have joined Titletown Tech, from places like the university system, which is a core partner of Titletown Tech, to bring the teams together and work with the entrepreneurs in the team to grow and scale their business, really with a focus on creating impact. And I'm sure that's the reason why you're here today, is by figuring out how we can all collaborate, work together, and create an impact that's positive in the lives and the health of people not only in this region, but across the world. Thank you again, and welcome to the conference.
So whether you intend it or not, and whether you're aware or not, whatever your industry, you're also in the healthcare industry. And what we found is that the principles to solving healthcare problems are the same principles used in solving other business issues. And so when you listen in to this next conversation between Craig Dickman, me, and Steve Tynck, you'll find that other industries are solving problems through innovation that we could also apply to healthcare solutions. Take a listen.
A startup can move at a speed that a big company can't. And that's one of the things that's really unique, is even when you see some of these problems that crop up, and they always crop up. There are always kind of new challenges, there are always new problems, and when they crop up, sometimes the organization is in a position to put resources against it. Yeah. But sometimes it is that startup, it's the entrepreneur who's coming at a new way, who's more flexible, who can move faster, who's able to bring something of value in really quick. And then the combined, what's happening with the organization startup just creates a whole different level of value.
So what are the stages, Craig? What do you see as the stages from an innovative standpoint? It's hard, you just mentioned it's hard for the big guys to move, but they want to protect the innovation that they have.
It really is. And it's funny. One of the things we try to do when we're working with an organization is get them to redefine and think about innovation differently. Because there's this sense that, it's this magical thing that occurs and only a few people are creative and this spark, and that's what innovation is. And that's not what innovation is. At its core, innovation is about identifying and solving problems. And so when we look at different stages of innovation, we really think about it in three different ways. First, if a business has a business model, the first thing that you think about innovating is making the business model stronger. Because every business wants to protect their business model, make sure it's competitive. So that's where you bring in changes that may be process improvements, you might be looking at automation, but things that are fundamentally designed to make the operations of the business model more effective. Then as we start expanding that, we think about the next level, which is about expanding a business model. So how can you take the value that you're creating and get it in the hands of new customers or new markets? Or how can you identify among your customer base what other needs they have to bring new value to them? So it's really about stretching a business model.
Making it more accessible?
Absolutely, making it more accessible. And what's interesting is that typically includes kind of culturally a lot of people through the organization. So I'm always nervous when an organization creates an innovation group and takes 2 or 3 people, sticks them off in a corner and says, you guys create something new.
Yeah.
Because innovation is something that should occur across an organization in total. And on the first level, it's people who understand the process best, who can best come up with new ways to improve it. Sure. Same thing, when you're stretching a business model, usually it comes from people who are aware of and seeing problems that are existing with their customers or their market, and then think, we've got a way to solve that. And that's where I've always said the most effective way to create an innovation pipeline is by teaching the organization and really educating people who are part of the organization to listen to their customers and listen to the market.
What is it? I'm sorry to interrupt.
No.
I'm just curious though. How do you know? Sometimes the customers don't know what they don't have, or what they need that they don't have, right?
So, absolutely, and that's why I never ask them, because they don't know.
Yeah.
You can't ask a customer, hey, what problem are you having?
Yeah.
Because they aren't going to identify it. But what you do is when you go in with the idea of really listening. And you will hear, if you're trying to get out of sell mode, you'll hear what their frustrations are. And I've seen many great businesses and products develop because it was something that was tangential to the main conversation, but the person heard, wow, they're really frustrated with this. That's not relevant to me today, but then bring that back and say, hey, here's something that I'm hearing in the marketplace. And especially if you start hearing it 2 or 3 times from different customers. And so that's where just listen. And sometimes the open conversations, when you're just trying to get to know what the organization is doing and what their priorities are, that you can really use that as an opportunity to kind of create that pipeline, because the market will tell you if you listen, but one of the worst skills many of us have is our ability to listen when we're doing that. We like to do direct question and answer.
Right.
So
what's the third level? So first level, second level of customer.
That's right. So the first is protecting the business model. The second is expanding. The third one is really transforming and creating something fundamentally unique and different. So it's really where you take your business into new and kind of uncharted territory. That's one of the things, frankly, that we see here at Titletown Tech is that oftentimes those are really tough to do inside the organization. Because organizations, very DNA is very good at protecting their business model. And sometimes a transformation can be seen as a threat to that business model. And so what you've got to do is make sure you really either build a culture that allows people to challenge their own business model, or when that idea is being formed, literally take it out and work somewhere else. Because you'll need external experts, because usually when you're transforming a business model, you aren't going to have 100% of the expertise inside. You're going to need to draw from others. And so taking it into an environment where it can be safe, and then you have the opportunity to make a decision as you're developing that more transformative business model. And it's really, do I bring that back into the enterprise? And you do so, very carefully and very scripted. You plan as much coming in as you do going out, or that's where sometimes you'll see a company spin off a new business, or create a new venture, or create a new joint venture because they've seen a partner that can really do something unique for them. But I think the important thing in this whole discussion is that innovation isn't magic. It's not one person being brilliant. It's engaging an organization. It's listening to the market. It's exploring ideas. It's creating new problems. It's a repeatable process, and organizations can build their innovation capabilities just like they can build their customer capabilities. They can build their manufacturing capabilities. It's simply one other core part of business that has to be developed.
Sure, and by bringing outside experts in, it mitigates the risk a bit. Because it's a scary time for people to jump off that ledge and say, all right, we're going to rethink the business model.
Well, it both mitigates the risk, and it also, you bring new thinking in. You can bring in new expertise. And oftentimes, one of the first things that shuts down innovation is either somebody saying, well, that's not the way we do it. That's not the way we've done it. Or when you run into a situation, I've seen this many times, especially with larger organizations, where for something to go forward, you've got to have, 10 vice presidents all say yes, 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 yes. And if one can say no and stop the whole process, the odds are almost impossible. And that's where you've got to kind of take it outside, mitigate risk, like you said, and bring in the expertise that you need to take the idea far enough along that then when you bring it back, people see the real value. Because what we find so often is people kill it really early in the process, when it's not developed enough to really be clear on what the value is, but it can be perceived as a threat. So if you look at where innovation dies, it usually dies for, one, lack of courage, because people just decide, hey, this isn't worth the battle. Or it's really early when somebody's got this idea that they think is a remarkable idea, and they just can't get enough built around it so that everyone else can see the value that it creates. And so that's where sometimes creating a different environment to bring it into really can make a difference. And it does de-risk it for the whole organization. And simply what you're doing is you're letting your own organization and your own people explore their minds and their markets further.
And how do you get the culture? You just mentioned the vice presidents all lined up, which is a cultural aspect of it. How do you start to shift the culture to be more adaptable and be more open to the transformation of the new ideas?
Well, I really think it comes in a couple of ways. Like I mentioned before, I think one of the important things is to have people across the organization really feel that they're part of the innovation process. Because I think
everybody, receptionists to the folks that are answering telephones, to the people that are greeting folks, the accounting group, it can come from anywhere, right? This is not just These are the thinkers of the company.
That's right. And
the
it should,
executives, right?
It should come from everywhere.
Yeah.
Because you're right, the receptionist is going to know the process of that first engagement with the customer or the market better than anyone else.
Right.
So if you tell them, hey, innovating is finding a better way to do that, to leave somebody feeling more engaged, feeling more connected to the organization, and really start opening up that thought of innovation to them. So again, it isn't defined as something that's kind of unique or magic. And it's really teaching, an organization, how to think about it and that they value it. So I think when it comes to innovation, it's really about engaging the whole organization. Mm-hmm. Second, when people have ideas, making sure that, the people who decide what to fund don't just become the door of no. Because I've also seen organizations where it's like we want everyone's idea, and then literally they don't take any of them. So it's just kind of, and you lose credibility really quick. So you've got to make sure that you engage, that you're open, that you are actually working on things that are meaningful so that you believe it. And then the other thing is being transparent about it. Because I think one thing that organizations kind of repel is if they think that all of it's being done in secret, there's always a fear of the unknown. Yeah. But when you can bring innovation out and know that, hey, here's things that Steve's working on, and here's things Kurt's working on, and can engage and get other points of view in a safe environment that's really focused on advancing the idea. So it's interesting. In just two quick examples, back in my former days before Titletown Tech, we used to, as an example, share our entire innovation pipeline with all of our customers. And totally open. I had people tell me that was crazy when we started doing that. Because we're laying it open for anyone to steal, and that's a way over concerned aspect.
You're free to most.
Oh yeah, and you've got to be talking about ideas if you want to advance them. And then we tell customers, hey, if you like any of these, and want to co-innovate with us and be part of the solution, be part of it with us. And that was the way we weeded out what was interesting and what wasn't. Because if we showed something and nobody in the market was interested, we killed it.
Sure.
But if 3 people said, hey, this is a problem that I really love to see us solve, we could enroll them and have them be part of the solution. So I think there's a lot of value in transparency. And then we were also talking, earlier, and here at Titletown Tech, one of the things we find is oftentimes the entrepreneur comes from those people inside organizations who have been working their entire life on, maybe supply chain or maybe something related to food, and they just see an unmet need. And if the organization isn't kind of engaging them, what we often do is find, hey, I believe so much in solving this problem, I'm going to pop out and use that expertise. And so what's interesting is sometimes even in the innovative entrepreneur, there's this view that, it's the young 25-year-old college kid. And what we find study after study shows, the optimal time for somebody to launch a business is that 42 to 44. And they're most likely to be successful because they've got experience, they've seen real problems, they know how to solve them, they've got those leadership skills. And so if you look around an organization and see how many people you have that have the potential to be innovators, you think completely different about your organization.
Yeah, how do you step?
And they have been constrained right in their head by years of the same organization telling them how it should be.
But you've got, Craig's idea of fostering that way of thinking and promoting it, even ideas that don't go anywhere, right? If you can encourage it, that's an awesome idea. It's not going to work exactly like you thought, but keep thinking like that. Yeah. Right? That's the right idea. And fostering that culture of challenging the status quo, there's always room for improvement, right? Every one of us is dealing with different parts of that in our business and our personal lives. There's things that we want to make a little bit better, which is interesting.
I think that's true. And it's also one of the few areas in business where you have to go in acknowledging that, what you do is not always going to work and failure is okay.
Yeah.
And so, if you have 5 ideas and 3 of them just don't work, that you've explored them. Because also every time that happens, there's learning that's taking place. You're kind of reinforcing to the organization that you're open to new ideas. And what you want to do is make sure that, when you decide to kill something, and most are going to be killed, so because that's just the nature of it. Because you're not, if nothing ever gets killed, trust me, you're not stretching yourself enough. And just make sure when it does happen that you're adding kind of, okay, here's why. Took a look, tested in the market, didn't think this made enough of a difference. So let's keep working on solving it for the market or whatever it is, or boy, the economics don't work, just whatever it is, but coming back and closing that loop to say, we're not going to move this one forward. Here's why. Let's keep working.
An interesting thing about the issues that we face in healthcare, that the solutions don't necessarily need to come within the healthcare industry. In fact, if you're only looking within the healthcare industry to solve healthcare problems, you're probably selling yourself short. Many solutions to our healthcare problems are being designed solving problems with companies that are outside of the healthcare industry, but equally applicable within the healthcare industry. If you listen to what Brian Rasmussen has to say about the way companies have innovated, and think about the ways that we can take some of those concepts and apply them to solving healthcare problems, we're going to be much further ahead.
Innovation is alive and well in our New North region. Hi, I'm Brian Rasmussen, publisher of Insight Magazine, and I invite you to read our Champions of Innovation publication. We are blessed in this region with existing companies and corporations that are really leaders in their field. But as we take a look at those companies, whether it be in manufacturing military vehicles or warships, whether it's two-stage snow blowers or people in the packaging or food industry, many of those innovations, including the smart toilet and even today's new rollout of the U.S. Postal Service vehicles, have come because this company started in the beginning by solving maybe a very unique problem that was in the market. Maybe it was even a simple solution or a change of a habit that helped solve that problem. But now they've grown on with new innovations and have grown to be the companies that are leading in our market today. This past year, we were definitely thrown a lot of challenges. We had companies who needed to rise to the occasion and do something totally different, maybe deliver their products or services totally different. And that's why we wanted to have an opportunity for those companies to tell their story in this year's Champions of Innovation publication. We were blown away by the response that we received. And in this special publication that was delivered with the May issue of Insight, the companies told their own stories about how they made pivots, how they rose to the challenge and solved a problem that was existing. We saw automation in manufacturing. We saw solutions in air quality control and safe drinking water. There were other industries like the education industry, the financial industry, that were providing and delivering their services in a different way and at a time that was really needed. Think about mental health care and how that had changed and how they were delivering that very important service during this time of COVID. So anyway, you can read all about these innovations in our Champions of Innovation publication, and you'll also see that the entrepreneurial spirit was alive and well as new products were being launched as well. So I really encourage you to enjoy today's conference, getting some of the new ideas and innovations, maybe even some habit changes too, that will create great results for you in the challenges of rising healthcare costs. So enjoy today's conference, and when you get a chance, read our Champions of Innovation publication. It's available on our website at insightonbusiness.com.
So how important, both of you, I'd be interested, is just getting started, right? So if I were to think about digitizing healthcare, Craig, it's a massive opportunity, right? There's a lot of different places that you could take that concept. How do you just get started in a space? What have you found are the ways to at least get off the ground and start moving somewhere as opposed to just waiting for the perfect, situation?
Yeah, and I think that's a great question. It's how you define the beginning. So if you say, I want to digitize healthcare, like you said, that is so massive that it's impossible to kind of know where to start. But if you say, hey, I have this problem because we're having a hard time reaching, whether it's this population or, we have a hard time utilizing this technology or using this data, whatever. But it's defining a problem. Say, okay, I can solve a problem. And that's really where innovation begins. And you solve a problem and then think, okay, if I solve this, now how can I expand?
Right.
But instead of thinking the world and shrinking it, think about solving a problem and then expanding on it.
Yeah. Once you solve that first problem for a client, they come back to you and ask you, what about this? Could you expand that program a little bit further to include more of my people? Could you address a little, or maybe it's even another problem entirely? Hey, you did a nice job with this. What about this? So inbound?
I think that's right. And you do find, we were talking earlier how, innovation, you kind of listen to the marketplace. Yeah. And the more they define your organization as an innovative, creative organization, the more willing they are to bring you problems that aren't directly related to what you're doing. And that's good.
That's fascinating.
Because, that will start feeding,
right.
What is the capabilities for you to become an innovative organization.
I like that.
And what's also interesting, what Craig brought up, is that there's a lot of people focus as part of this. Without the people, it's hard to get anything done, right? So by listening, to your point, Craig, and by allowing them the option to freely think and then taking their ideas and doing something with them or giving them good reasons why it didn't work, is going to help to continue the process, right? Or continue the thought.
Technology is going to change, Steve, right? So the way that you solve a problem today is going to look very different, 3 years from now, 5 years from now, 10, right? So it's not, I don't necessarily think it's about the solution so much as it is the process to get to the solution. And then I think you almost need to have this built-in obsolescence. Yeah, we solved the problem like that back in 2020 because that's what we had to deal with, and those were the resources that were available. But come 2025, we're looking at that problem totally differently.
Sure.
But the process is there to allow us to understand that, right? And to make that shift, to make that
to continue,
right?
Find those new opportunities.
So what I'd be interested with regard to Fork Farms and where you started with the agricultural component. I mean, Fork Farms can't do everything, right? You're not growing watermelons.
That's right.
But you can grow something, right? You can start somewhere. So talk to me about how you got off the ground and why that's so important.
We really thought that the opportunity was in highly perishable foods. 95% of the foods that we consume are grown in a couple places in America.
Yeah.
And they travel a long distance to get to us, 2,500 plus miles to get to Wisconsin. And that's what people need to be healthy, is the highly perishable foods, the herbs, the lettuces, the vegetables. So we saw the need and then optimized the technology to encourage the growth of those, but hyper-localize it. So, if you're ever at a grocery store and you look at the clamshell from a lettuce, maybe a lettuce or an herb, the expiration date is 3 days after, from the day you're standing there. It's because it's been on a truck or in a packaging house or it's been somewhere in the field, being transported to us, and that's why you kind of pick out the dead stuff,
Right.
So if you grow it local, it'll last 4 weeks. But most importantly is that the nutritional value is 100%. And 3 weeks after you harvest, typically from a traditional agriculture, we've lost almost 50% of the nutritional value.
So can you talk to me a little bit then also, when I think of new products coming to market, you got to hit a number of aspects for a client.
Sure.
The functionality, yes. The price point, definitely. And then the quality pieces. I think whatever you're doing, whether it's a service or a business, it's those elements are somewhere ingrained in there. Talk to me a little bit about that.
Absolutely. So the product has to be differentiated and unique and fill a gap.
Yeah, and what I think Fork Farms has done from what I've seen also is really, like you're saying, change the way a customer market thinks about it. Because if you just compare product to product, well, that's one thing. Right. But what you've been able to do is show the value of, understanding when you can grow close, when you maintain that nutritional value. So there's an incredible education piece that also comes that I think has been a reason why you've been able to succeed. It's more than a product. It really is about teaching a market to think differently.
Yeah, and what you do with the product. Right. How you put your own
how you do it, what it represents, because you're right, it represents so much more than just that narrow focus. But that's where you have to start so that you can get people to understand, the direction that you're asking them to go.
That's right.
So I like the way Craig talks about this. To lead is to look back and know that there's somebody following. Right? You can be out there, right, and standing on your own and not much support, right, which is not what we're talking about. It's making sure that you're bringing a group of folks along with you and that you're adding value. Right?
And that's why we're really grateful for Titletown Tech. A community came together under Craig's leadership to say, you know what, we want to figure out a way to keep innovation alive in Northeast Wisconsin.
Yeah.
Healthy, accessible, available to everybody, and give startups a platform for allowing that to happen. And I don't think there's anywhere else in the country that's doing this today.
I'll tell you what, this is why I'm so excited to be here in the company of both of you guys. You both have done it. You've been there, you've done it, you've created things of value, you've made the community a better spot to live in, to work in. From the NOVO Health perspective, really, if I were to give it the highest level of understanding, I want to redirect healthcare dollars so that we can make this more accessible and more affordable, so that I can reinvest dollars in the community. So I want to take my dollars that are being spent on healthcare delivery and put in the new music venue, put in the new arts, place to watch.
Because it creates happier, healthier people.
Living in a community is all of that, right?
Yeah.
Yes, I want to be healthier. Yes, I want access to innovation, but it's really this camaraderie, right? And this connectedness and feeling
caring for each other.
Yeah, you're part of something bigger.
Yeah, that's right.
Right?
Yeah.
And Craig has described this all afternoon here as to why it's so important for his organizations to change the culture. I firmly believe that.
Yeah. Well, I do think, like you said, there's a real sense of community that comes with it. And so, when you think about business and what we're doing here at the fundamental core, business is about creating.
Yeah.
And like you said, then business plays a role in making sure we have a healthy community, and that's making sure, science, education, arts, health, all of them are strong functioning areas within the community.
Yeah.
And I think one of the things that we've learned in our time here at Titletown Tech is, we are really blessed with being in, a core region where I think we have a lot of creative people. You look at some of the great businesses around here, and you can point back to the individuals who grew up here who started them. Mm-hmm. And so really part of what we're trying to do with Titletown Tech is kind of unlock the native creativity that exists here and the need to solve real problems. Mm-hmm. And that's one thing that sets our region apart too. You do see it, I think it's a thing that you see on the coast, is sometimes you're chasing the latest technology for technology's sake.
Right.
But here there's both ability to create and innovate, but also connected with a great work ethic, great sense of community, and a desire to solve real problems. And that's why I think our region is well positioned to work on these new opportunities like Fork Farms and bring new capabilities to the marketplace. We're as well positioned here as anywhere, and it's also important that we begin believing that.
Yeah. I think that's a huge element of our future success, is making sure that everybody here understands that the best technology, the best ideas aren't on the coasts.
Right.
We're not a flyover state. We've got an awesome opportunity here to take our resources, just organize them a little bit differently, lead them a little bit differently to start to do some special things here.
And isn't it amazing where you get strong organizations like the Packer organization, Microsoft, and others that have contributed to the success of Titletown Tech, other than just their core business, but they see it in a completely different
their
way,
role. Yeah, they
which
believe
is
their role is
amazing.
bigger.
To your point, right?
I like that. Yeah.
Absolutely. And I think that, so many of the folks that are involved in Titletown Tech recognize the desire to create value, make sure we've got a strong economy, strong community, also have a place that attracts and keeps really talented people. Mm-hmm. And so as we become more digital, we've got those skills to work with those places to do so. And then I think one of the things that, Packers and Microsoft really brought to this as well is this, sense of being able to connect and convene the right parties to come together and work with the early stage companies and help, hopefully kick open doors and find new ways for them to get to market, create connections into things like the university, and recognize that, innovation is a very collaborative experience. I mean, it truly is a team sport. Mm-hmm. And I think that's one of the things that gets reinforced in an environment like this.
Yeah, the team sport comment.
Yeah, I love that.
Fabulous, right? Because it does. It takes everybody working together to pull it. We all have different skills, talents that we bring to the solution set, and you need them all to get the thing off the ground, right? And this is idea that ideas can come from anywhere. Make sure you're being transparent, collaborate with the entire team. Yeah, I think that whole team aspect is an important one to kind of bring home to the conversation. It's a good part. I know that a lot of leading healthcare technology happens in places like Rochester and Cleveland and
Sure.
both of the
Kaiser
coasts,
Permanente.
right?
Yeah.
But they have many of the answers that are to legacy problems or problems that have been tweaked, but not to reinvent the whole healthcare delivery system.
Right.
And then to think differently about healthcare delivery to the point of including things like healthy eating and how can we make it easier for people to do the things that we know are better for them, with regard to their health. Right. To avoid having to treat people post-issue, which is what we do, right? We now, hospitals are treating people that are sick instead of encouraging people to be well.
Right.
And so how do we shift that whole mechanism?
It's interesting, Kurt. We just finished up on a study at Fork Farms with the local health department and one of the major school districts in the area. And we asked all their fourth graders, where does fresh food come from? And we had a lot of different answers, but the number one answer was the local gas station. And so, and they were just being completely honest and transparent with us. So we knew that how do we modify those behaviors? How do we change their behaviors and have them thinking differently about it, to your point? So they started working with the Flex Farm, and after 4 months of working with the lesson plans with the instructors, as well as their fellow peers, we did the same survey post-Flex Farm, if you will, or post-growing their own food. And the results were absolutely significant and were amazing. We saw a 46%, and this is to your point, a 46% increase in just the perception of fresh food, where it comes from, how food comes to the table, how food comes to the grocery store, how I actually get to eat fresh food, and a 33% increase in the consumption of fresh food. And
they're staggering numbers.
It's amazing because those, not only do the people that are involved with it, the kids that are involved with it, have that increase, but then they bring it home to their parents or their grandparents or their sisters and brothers, and they talk about what happened. So when it comes to behavior change, it's incremental, seems to be small, and it seems to be, you have to be emotionally connected to it somehow.
Right.
It's like anything. It's like our homes or our families or whatever we're proud of and whatever we're engaged with, we take better care of.
For sure.
So healthcare is something that in the past, when we were sick, we went to the expert and they did their best to fix us.
Right.
So how do we together use the NOVO model of health to say, let's understand what the motivation is and education and the activation of those principles together. And most importantly, we have to also celebrate the successes when they happen. And we have to start with people early on, more in the preventative stage, don't you think?
Right.
Than we do of let's wait and see how it turns out.
Exactly it. So we have a set of circumstances that we're dealt today. So we've got the existing health of our communities, or lack thereof. We've got the existing medical conditions, that we've got to deal with, chronic disease management, joints that need to be replaced, issues that are symptomatic of things that we have done or haven't done, right? To take care of ourselves. So if the NOVO Health model can encourage people to act differently in the consumption of healthcare, that is part of the solution. And so when we're thinking about what we bring to the market, it's really this platform of thinking differently. Because the solutions are going to come from many different places, and they're going to be relevant for a period of time, but ultimately how we replace joints is going to change decade after decade. It has for years already.
Right.
So that's not necessarily the answer. The answer is how do we make sure that more people are aware of the most recent solutions and then start focusing on how do we get better access to high quality, low cost solutions.
Right.
And then you start to think about, okay, how do we avoid that situation altogether? We need to be taking better care of ourselves, and then Flex Farms fits into the NOVO model.
Sure.
Right, as a precursor to where we know things ought to be, right? So it's a very inclusive model. The platform allows for many different organizations to collaborate on making, healthcare happen. Whether it's at the individual level for you and me, our families, the places that we work, ultimately our communities, right? So when you think about Titletown Tech and what they're trying to do to make, the community better.
Same exact principle. Right.
We share
and like Craig talked about with us, bringing in partners and outside people to help through the innovative process. Because we all get stuck in a rut after doing something for a long period of time. Not that it's good or bad, right? It's just we get stuck, and it's hard to break out of that.
Right.
Unless we have an inspiration or a partner or a person or somebody that helps us champion it and kind of nudges us a little bit in a different direction, can show you the results.
Right.
And then as a result of all of that happening, we see the change.
Right. So you need some kind of a change agent to fix your culture, to start your culture to thinking more about how do we innovate iteratively, right?
Right.
Not that I have a home run, solution every time I turn around.
No.
How do I hit a bunch of singles? How do I do this, just incrementally and over time get a little bit better?
Mm-hmm.
And then as we were thinking about this too, because again, you've got a solution right now with the Flex Farms unit that is using the latest technology, producing awesome results with regard to quality and cost and access. That's going to change over time. And so as it hit us, right, was we were thinking about the different solutions. It's the process.
That's right.
Right? And so
Absolutely.
literally we kind of
it's
came
not
up
the person.
with this.
Absolutely.
It's the process, stupid. You've got to think differently.
Right. Yeah.
Right?
Yeah. There's no question about it. So to that point, we knew that the agriculture technology was going to be a differentiator and a disruptor in the market. But it's not about the product. It's about the NOVO model of everything that surrounds it. So we knew without lesson planning and curriculum for fourth graders, we weren't going to get the results.
The education component is the adoption.
Is critical,
It's
right?
the
We
adoption.
knew it wasn't about the actual physical product. It's about everything that wrapped around it that we can help people understand in eating healthier and feeling better and ultimately happier, which is just one component of everything that we know goes into being a healthy person.
That's it.
But without that core piece, you're going to always go back to the old way. Right. So we got to continually nudge our teams, nudge our people, nudge the people that we care about to think differently, to your point, and go on a different path.
How do you make it easy to make the right choice?
And reduce the barriers.
Right? Make
Absolutely.
it super simple to do the right thing.
Yep.
And so part of it is to set up a situation for our employees where they know how they can access, any of the solutions that we're, looking to put in place for them with an easy to call phone number, easy way to reach us to ask questions. Apps are the way that we talk to each other, right? The way that we consume data today, the way that we connect with one another, right? So there's things that we're doing that are, again, current with regard to how we change people's way of thinking, change their way of interacting with the health system, and ultimately, buy differently.
Yeah.
Right? Because if you don't make it simple, it becomes, as you say, it's too difficult.
So where do you see the evolution of healthcare going, Kurt? Like, let's say, we're in 2021. What do you see 2025? People being more engaged in their own personal health experiences than they are today, or how do you see that evolving?
I think it will. I think it's going to change, similar to the way we've talked about other changes. I think barriers are going to come down that are going to enable people to meet with their doctor more easily. So I think telehealth is going to become an increasingly used medium to connect with your healthcare provider.
Look what we just went through with COVID. It's
exactly right. Telehealth visits
Zooming,
were much higher than they were, previously. The technology existed, but we didn't have that motivation. It wasn't easy because you need both sides to participate. Both the providers have to be willing and able, and the patients have to be willing and able. Do I want to interact with my healthcare provider online? Well, this showed us that yes, I can, and yes, it works out very well.
Quality is
there.
Yeah.
So I think that's going to happen. I think ultimately also the delivery mechanism for physicians is going to be different. They want to provide really good service to their patients, and they don't want things getting in the way, like a cumbersome EHR or facilities where I can't find a place to park and I've got confusing navigation and all of the issues that are existing today with regard to how I consume my healthcare. So I can eliminate those things. Have a smaller facility that I operate from. It costs less. I can produce the same high quality. You can drive up to the front door and get in, same day access. All those things I think are going to be the changes that we see happening. They've happened in other industries where things have become very convenient for us. If you think of the retail experiences, a lot of it is online. A lot of it is when I want it. I don't need you until
Ease
I
of
need
use,
you.
to your point, yeah.
So I think that we're going to see a lot more of the barriers coming down as we realize that the consumers of healthcare really want to be treated like a guest. They want to be treated a little bit more like a customer as opposed to a patient.
And giving those experiences, regardless if it's from a medical side or from a food side or fitness side, all the pieces that go into a healthy person, easy access to all of those.
I think so. And I think what's going to happen is we all need encouragement to do the right thing. Right. I need the encouragement of my family, to eat better, to get out and exercise more. And that same, motivation is going to be what causes us to change our eating habits as communities, right? So if everybody is doing it, well, I'm no longer the odd person, right? I'm not. This is just the way that we do it.
It's interesting. We have a number of healthcare systems that work with us that actually bring farming operations into the community spaces. To encourage healthy eating. So they'll put a flex farm in a thrift store or the schools or a senior living facility.
Brilliant.
All to encourage people to understand where healthy food comes from.
Right.
And they can be part of it, to your point, from an emotional engagement standpoint, because if you take care of something, you're best able to use it.
For sure.
Right? Whatever that might be.
For sure.
And we see that as some of the future of how do you take, the system's been traditionally broke, right? 95% of the leafy greens are grown in 3 places in America, and they're 2,500 miles away from Wisconsin.
Right.
By the time you get here to 3.5 weeks old, they've lost 50% of its nutritional value. It makes no sense from a health perspective.
Right. You look at it and you'd say, why in the world are we continuing to do this?
And this is similar to just the whole healthcare process in general, right? So how can we make a little dent and help people with that using the NOVO model?
So again, as we are here in the shadow of one of the greatest football venues of all time, we're talking about teamwork and how is it we work as a team to improve our healthcare. And realize that it's more than just one element of these 5 steps that causes us to be totally successful. It's in addition to educating and motivating, it's practicing these concepts with our teammates, with our employees, to make sure that they know exactly what to do and when to do it. Practice makes perfect. How often do you practice with your team to make sure that they're using their healthcare benefits to their greatest potential?
I got good feelings about our first game this year, team, especially after going winless last year. I know that playbook I handed you guys last fall will make all the difference. And I know you studied it, so let's get out there and make it happen. You guys remember the playbook, right? That high-quality binder, pretty colors? Assistant Coach Smith, can you please remind the players? It's game time. Now let's go show them what we're made of. Hey, Coach, maybe we should have practiced? Shown them how to run the plays in the book? Nonsense. They're going to be fine. It's offense. It's defense. It's easy. Oh, I think it's going to be another long year. Does this scene sound familiar? You get your employees, your team, together in a room, hand them the new benefits plan, and after a short presentation that would lull the most vigilant to sleep, send them on their way until next year. And then we're surprised when it does not work. Too often we see companies changing networks, changing plan designs, changing programs, changing partners, only to find they get the same old results. But why? For all the changes companies make, they often overlook the one that is the most important to success: employee behavior. If your employees don't know what to do with the healthcare plan you have created for them, they will seldom make the right call when they access the care for themselves or their family. You can have the best healthcare plan in the world, but if your employees don't know what to do and when to do it, you will never achieve the results you want. If we continue our sports analogy, a team will practice the elements of its game plan and playbook for hours, days, and weeks before they try to execute. And that's why they are successful. The players know what they are supposed to do for each play. A good coach breaks down the skills to make things easier, celebrates development, not just the victories, and keeps the team motivated. We need to bring the same process to healthcare. We not only need to design a great plan, we also need to teach our employees how to use it, make it easy to use, motivate them to take part, celebrate behavior changes, and practice the execution. That is what the 5 Steps to Healthcare Independence offer. A process that coaches your players to execute the right healthcare play for your plan design when the time comes. It's not the plan design, your game plan, that improves healthcare. It's the process that matters. Your employees need the same practice and coaching team as any sport to change their behavior. You coach for career development, why not coach for healthcare decisions? Let's look at the 5 steps to healthcare independence and how you can apply this process to coach your team. Novo Health's 5 steps to healthcare independence are evaluate, motivate, activate, educate, and celebrate. Let's address them one at a time. The first step, evaluate, asks you to do some problem solving. Before you can ask anyone to change their behavior, you need to know exactly what it is they can do to make a real difference. What are the biggest problems keeping your company and your employees from healthcare independence? Dive into your claims data, talk with your trusted advisors, and figure out which problems are most critical for you this year. Once you've found them, compare multiple solutions to find the best fit for your company. Get as specific as possible, matching problems to solutions. Keep asking why. For example, if you spend too much on specialty care, is it because your employees are treating with primary care providers who refer to high-cost specialists? Or is it because your employees are not getting primary care at all and incurring specialty costs to treat preventable problems? The right solution depends on the cause of your problem. If you have multiple problems to solve, look for the easy wins first. Don't try to do everything at once. Start somewhere and build momentum. The second step, motivate, is just as it sounds. Give employees a reason to want to do something different. Motivation comes in multiple forms. This could mean designing your program to offer certain options free of charge to employees. Or you could offer a cash bonus, contest entry, or gift cards to encourage certain behavior. You may explain that cost savings will be used for facility improvements, wage increases, or other benefits that will directly help employees. Some companies we studied had blunt conversations about how taking a particular action would save jobs in a manufacturing plant or allow a school district to keep certain programs available to students. Illustrate big numbers or concepts with more tangible things. If just half our workforce did this, we could buy 3 new machines, hire 10 new team members, buy 5 cars, or double your holiday bonus. The third step is activate. Make it easy for your employees to do what you want them to do. Motivation is great, but it fluctuates. Many times when your employees most need healthcare, they are not emotionally at their best. They are injured, sick, or worried about a family member. In case motivation dips, make it easy to do the right thing. How might you do that? Find ways to get the ball rolling when employees are most motivated or most capable. Is there something they can sign up for or authorize during the annual benefits meeting when a topic is fresh? Sometimes just helping an employee know how to get started can help. Instead of asking employees to use a center of excellence, try asking them to download an app or save a phone number in their cell phones that will easily connect them to your centers of excellence if they become sick or injured. If you use your own benefits plan, consider yourself a guinea pig. Think of any hurdles you can clear in advance. Help your employees by setting up cues to remind them of what you want them to do well after your annual benefits meeting. Send a postcard or an email. Place a sign on the refrigerator in the break room. Have your on-site clinicians distribute information about certain programs at the time of an injury or when illness develops. What can you do to cue that desired action and make it easy to get started? The fourth step is education. Are you surprised that it's fourth? Education is critical. If employees do not know what it is you want them to do, they will not do it. The reason we've placed education after the first 3 steps is that so you can teach employees exactly what they need and what you've done so far to help them change behavior. This recipe for success should not be a secret sauce. You're trying to help your employees. Spell it out. Explain what to do. Explain the why you developed in the motivate step and how you developed in the activate step. Show your employees you are on their side and ready to support their efforts. Vague explanations of plan designs are nowhere near as effective as specific requests of what to do, why it's important, and how to do it most easily. For example, teaching that inpatient facilities cost more than outpatient facilities do is a good first step. But I'm more likely to choose an outpatient facility for my surgery if you pay me a cash bonus for choosing a center of excellence with a care navigator who can get me priority scheduling and a paid travel bundle. tailor the message, of course, to your specific strategy and offerings. This is not a one-size-fits-all. Educate often. A steady stream of actionable education is also a reminder that can cue behavior at the right moment. Last but certainly not least, the fifth step is to celebrate. Yep, celebrate. Let employees see the tangible ways you have reinvested in your company, your workforce, or your community. Highlight your achievements at the annual review you have coming up. Let your shareholders know and energize your employees. But don't wait for a once a year and look for more than just the numbers. Not every strategy succeeds. Some require further refinement. A whopper of an unforeseen claim can throw things off, or the solution you selected just didn't pan out. Don't despair. If you have saved a ton of money, well, you might have knocked it out of the park. Or you got lucky. Celebrating success is a great idea, but celebrating change is even better. Celebrate every time someone changes behavior and does what you ask them to do. If an employee takes the chance and makes a change, thank them. If possible, thank them publicly. At NOVO Health, we will often ask this permission of employees proactively and help you capture written or video testimonials. But why? Well, we use the same 5 steps to help support your behavior. We want to make it easy for you to share testimonials to celebrate positive changes and because you can use them as a powerful reminder for other employees. If someone changed their behavior and did what you asked, that is worth celebrating. The 5 steps are an ongoing process. They're not a list, but a wheel. When you complete the 5th step, go back to the 1st. Evaluate the strengths and weaknesses of how you developed these 5 steps. What worked? What could you do differently? Have any of your problems changed with changing conditions? Have you addressed some changes and it's time to continue to the next? Happily, these same 5 steps will continue to guide your journey. NOVO Health and our community of companies are here to support you. All of our programs are designed to provide you options and tools to complete these 5 steps. We welcome new ideas and suggestions, and if you'd like help exploring how to apply these 5 steps to your efforts, we would be glad to talk through that with you, free of charge. Armed with these 5 steps, it's time to claim your healthcare independence. We'd love to celebrate with you along the way.
What a great day, Kurt.
Fabulous.
Yeah.
I am so excited, Steve. The content was excellent. The speakers, I'm so pleased to be part of that kind of a lineup.
Yeah.
Hasn't happened for me before this, and I am just so grateful that as we start, socializing these ideas, that we're able to attract the kind of talent.
Sure.
To get the message out.
Yeah. Craig is amazing.
Incredible.
And I thought the story he brought with Titletown and innovation and the thought process behind communities embracing the health and well-being of everybody around us is really powerful.
It's really powerful. And again, the idea that anybody can innovate and anybody can bring that idea back to their organization and start the whole process of changing a culture and changing the process of thinking.
Yeah.
Like we talked about today, right? It's all about the process.
Absolutely. Little steps.
We know this
Little
now.
steps, yeah.
Right?
Yeah.
And so anybody that's listening, take that opportunity, the occasion to go back to your employer, go back to your family, start the conversation, right? Even if you don't change behaviors immediately, start the conversation and see what kind of reaction you get. My guess is people will look at you maybe a little bit like, are you serious? But again,
change is hard.
Change is hard.
Right? But if we make, just like the 4th graders, if we understand it, if we emotionally connect to it, and really, most of us don't know where healthcare, it's traditional, right? It's always it's where it comes from, but how do we get in the preventative mode? How do we really start to focus on before we get sick versus after?
I completely agree with that. This will be, again, the end vision from our perspective. So healthcare today, in total, we're spending $4 trillion, right? Whether that's the government or the private sector, right? But that much money. Imagine if we were to take a portion of those dollars and be able to redirect them, because we're saving using NOVO Health solutions, and then redirect those dollars from an employer's perspective I can start to give wage increases, or I can increase the benefits that I've got, or I can set up a new facility or a new line.
Yeah.
Or as a community, what if I could, buy that pool, invest in the library, a performing arts center? I mean, all these things are possible if we start to just think about redirecting our spend in a way that is like truly living. I mean, just being able to walk and breathe and interact isn't living.
Right. But look at this. Yeah. This is one community's vision for what's possible by not only focusing on their core business, but looking around it and saying, all right, we want to help out the entire community in a way that's never been done before. And it took little steps to do that and all sorts of partners to come together. And before you know it, look what you have.
Here we are.
Yeah.
There's no question that it is by design that we are finding one another, right? That we've engaged in conversation with Craig and Titletown and Fork Farms and others of our partners, right? Because we all think alike. We've got this same vision for what could be.
That's right.
And there's a passion around this, right?
Yeah,
you can feel it, again, with all of the different components that we were exposed to today.
We all care about something larger than ourselves.
Exactly it. No question. Yeah. And so for us, and I'm sure you would agree with this, right? This is a generational gift, right? A lot of the benefits that we are going to be creating here will benefit some from these, right? But our kids and grandkids, hopefully,
they're going to be the benefactors of it.
Yeah, we leave the world in a better spot than we found it.
Absolutely.
And we contribute to something that is worthwhile. Yeah. Right? There's nothing more important, I think, to any of us than our health.
Yeah.
And so you leave this place a little bit better off. And so hopefully the folks that have tuned in today that are listening to this series take that motivation back and use this as a catalyst, right? A way to start conversations, small conversations, but hopefully increasingly over time a little bit louder, a little bit more involved, and realize that you can make it happen.
And remember, always eat more fresh food, more lettuce.
More lettuce.
Eat more lettuce.
It starts with lettuce. Exactly right. Yeah. Because there are far fewer health complications if we would trade that donut for a leafy vegetable.
Yeah, eat a Friday fish without the deep fry, just once. Just try it. You're gonna like.
You can do it. It's possible.
That's right.
Yeah. So very good. All things in moderation.
Thanks for the opportunity to be with you today. It was really fun.
Wonderful, Steve. I appreciate it. Thank you all for tuning in. Really appreciate it. Have an awesome rest of your day.
Bye, everybody.